After completing this module, you will have a better understanding of the application of medical codes in the healthcare industry. You have had the opportunity to learn what medical coding is and why it is important. Now let's discuss how codes are applied. Before you begin this module, complete your weekly reading assignments and view the presentation material. Let's begin with an example of medical documentation requirements. This is an outline of what the physician is expected to document during an encounter with a patient. The medical documentation could be very detailed for a surgical procedure or short and to the point for a brief visit to the doctor. Can you guess what the diagnosis is in this example? If you said the swelling of the right shoulder and a few small cuts and bruises on the knees, you're correct. The assessment is where the physician's findings are recorded in the medical documentation. The assessment translates to the reason for the visit, also called the diagnosis, which is what is used to assign the ICD-10-CM code. Your knowledge of medical terminology will help you locate the code in the ICD-10-CM. Swelling is one medical term, the other is abrasions, because cuts, scrapes, and bruises are all minimal injuries and are considered abrasions. Now that you know what to look for, the next step is to find those medical terms in the alphabetic index of the code book. Do you recall what each of the 3 code books are? There are 3 coding manuals. Each of them provides medical codes for reporting purposes. CPT stands for Current Procedural Terminology, and we are currently using the 4th edition. The codes in this book are for professional services and procedures performed by physicians. HCPCS Level 2, pronounced HCPCS, stands for Healthcare Common Procedural Coding System. This book provides codes for some special services for Medicare and Medicaid, as well as durable medical equipment. Wheelchairs, nebulizers, eyeglasses, and drugs are a few examples of the items you will find codes for in the HCPCS Level 2. The only code book that is always used, regardless of the setting or service, is the ICD, which stands for International Classification of Diseases. The U.S. switched to the 10th revision in October of 2015. The ICD-10-CM code provides the reason for the encounter and the medical necessity for the service or procedure that was performed during that encounter. All 3 of these code books are updated annually with new and revised codes, so it is important to use the most updated available version of each of the books. Here is an example of what the 2 diagnoses we identified from the example of medical documentation requirements look like in the ICD-10-CM code book. Services and procedures provided to the patient as well as the established diagnosis are reported to insurance carriers on the appropriate medical claim form. The CMS 1500 is the universal claim form and contains all the basic information needed to submit an accurate claim for non-institutional healthcare providers. It includes fields for the patient's demographic information, insurance information, and boxes in which to provide medical codes and corresponding dates of service. Claim form UB04 is very similar to the CMS 1500, but it is used by institutional healthcare providers such as hospitals. Let's take a moment now to do a quick review of the learning focus for success points. First, you identified where in the medical documentation you will locate the diagnosis information. Next, you used your knowledge of medical terminology to determine what the condition, disease, or injury was for this patient. Then you decided which of the 3 code books you would use to find the code you need to assign for the diagnosis. And last, you reviewed where the diagnosis code is located on the claim that will be processed for payment. Great job! Now it is time to see how well you understand the topics presented in this module. If you have difficulty answering any of the module knowledge check questions, please review the presentation again or contact your instructor or an academic coach for personal assistance. If you said C, the medical documentation, you are correct. If you chose medical terminology, you are correct. If you chose International Classification of Disease 10th Revision Clinical Modification, you are correct. If you chose True, you are correct. As you progress through your courses, you will begin to develop the skills needed for a successful career in medical billing and medical coding. Ultimate Medical Academy provides several resources to help you, such as instructor labs, academic coaching labs, and recorded tutorials in the video library located in the Student Success Center.